Hey, it's Dr. Sean Tierney talking about ultrasound-guided diagnosis, ultrasound-guided procedures, and treatment for Depuytren's contracture. It's a contracture in the hands. People can get on their feet. Sometimes that same disease will affect the penis as well. This Depuytren's contracture is basically a genetic tendency to form adhesions or scar tissue between your skin and the tendons and nerves of your hand. So at first, it just looks like a band of tightness in your hand. Eventually, you can start to close your fingers so you can't close them up. So what we do is we look at that structure, we identify what it is. Sometimes it's just contracted tendons, so we have to identify that's actually what's going on. And then once we see it, what we can do is we can use a large volume of fluid to get between the tendon and the contracture and separate the tendon from the contracture using water pressure. So we basically separate that so that you can gradually open your fingers back up. Hopefully you come to us a long time before those fingers start to close. Okay. Obviously there's surgical solutions, but they're tough. And it's a surgical, where there's a long recovery, whereas the ultrasound guided, where we can look at the structure and guide a needle into the area, is a much faster recovery. You feel better fast, you get better quickly, and it's safer, and it's less likely to have an infection. So infections with surgeries are common in the hand. Infections with after these needle procedures, we have never seen it, so it's extremely uncommon. Any kind of injection, you always think at your risk of bleeding, nerve damage, infection, but when we use ultrasound guidance, the idea is we can avoid that. So my number one concern when we're doing these procedures is to not damage the nerve or the vessels in that area. So we can use the ultrasound guidance right over the tendon to separate the contracture from the tendon and the nerves and the vessels. So if you didn't have ultrasound guidance, it'd be a very dangerous thing to do because the line between those is sometimes smaller than the needle is itself. With ultrasound guidance, we can see very clearly and use water pressure to separate the contracture from the tendon, and then separate the contracture from the skin, and then get into the contracture itself, which is almost like a leather belt consistency, and just with pressure blow that contracture apart. And the most important thing that we want to see is you have your functionality back in your hand. Some people are in the entertainment industry or whatever the situation may be where they want to have normal looking hands. We have to keep doing this repeatedly to get your hand to look normal. Usually it's one to three times to get your hand to function normal. So whatever direction, however far you need to take it, we can take it for you. But that Depuytren's contraction can be a disabling condition that's totally avoidable. And what I say is when you first start to see that contracture, you probably know that runs in your family. I call it Viking hands. It usually happens in people that are related to Vikings, the Northern European, strong people. Maybe that evolved for some reason. Maybe that helps your hands feel faster. When you're using a sword, I'm not sure the exact reason that the Vikings developed that, but if you are a Nordic person, you might have developed that condition. So we can hydrodissect the scar from the nerves, from the tendon, from the skin, and from itself, and we can use water pressure, mostly saline or sugar water, with a little bit of numbing agent and a little bit of anti-inflammatory. It's more of a structural thing than it is a chemical thing as far as a treatment. Now there are treatments that you just inject into the area that help dissolve that scar, which are also useful, but we've had extraordinary success and very predictable success using that just water pressure to blow that apart. Now it's really, really successful. It's really bad for the doctor because it takes so much pressure to inject and break up that scar tissue. So we're trying to develop something to save the doctor's hands, but we have a good success with helping your hands. So, Depuytren's contracture.